Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey Vet Rehabbers, watch the Vet Rehab Summit recordings. Guys, it's just a few more days, so please make sure you log in, watch the webinars, and download your certificate. This was our online veterinary rehabilitation conference, all about myofascial kinetic chains. It was on the 10th and the 11th of November, and you all had access for 30 days to the recordings, and that's coming to an end now. So please make sure you go and don't miss out on that learning. Today is part 2 of our degenerative myelopathy chat with Sarah MacKeigan from Upward Dog Rehab. The first part would have been episode 281, so you might want to go and have a listen to that before carrying on with this podcast today. Sarah and I chat about all things degenerative myelopathy. We talk about the internal versus external approach to treatment and how we can balance the right amount of exercise, and just so many more gold nuggets in both of those chats. So if these interviews have piqued your interest and you have identified, maybe you've got a small knowledge gap when it comes to treating these degenerative myelopathy cases, we've got a lot more learning for you in the Onlinepethealth membership. So I did a quick search. This is what we've got: degenerative myelopathy and your role as a clinician, which is lectured by Debbie Turaka. Degenerative Myelopathy Diagnosis and Rehabilitation by Teresa Pancotta. And in our Hydrotherapy and Dual membership, we've got a great webinar, Degenerative Myelopathy and Adapting Mobility to the Changing Phases of the Disease. And that was lectured by Kirsty Oliver. And we also have a research refresh about looking at the different laser protocols for degenerative myelopathy cases. So jam-packed with loads of learning. So you're going to head over there and you're going to fill that knowledge gap straight away. So if you're not already signed up to be an Onlinepethealth member, you can go to onlinepethealth.com and check out all our different membership options. We even have a free membership, and you can go to onlinepethealth.com/free to sign up. So before we head over to that chat, a quick word from our sponsors. Curacore's Vet's founder and CEO, Dr. Nada Robinson, has been teaching science-based integrative medicine for nearly 25 years. She first developed her courses at Colorado State University, where she started the Medical Acupuncture for Veterinarian Certificate program in 1998. And in doing so, Dr. Robinson developed a science-based platform for veterinary acupuncture, the first of its kind. Today, Curacore Vet offers a comprehensive curriculum in integrative medicine with a rational, evidence-supported foundation. Courses include medical acupuncture, photomedicine, botanical medicine, medical massage, and integrative rehabilitation. You can discover Curacore Vet at curacore.org. So let's head over to that second part of the degenerative myelopathy chat with Sarah. So we've got a question. It's from Roland. He says that oxidative stress is caused by the SOD1.
Yes, to an extent. So inflammation within the body, anything that's related to oxidative stress, again, is that imbalance between free radicals. And again, I'm coming to this as a PT, but that has done a lot of research. But oxidative stress is the imbalance between the free radicals and the antioxidants within the body. The cycle will create more oxidative stress, but any sort of inflammation, any, toxic environment, highly processed foods, anything that is kind of creating that damage within the body is going to induce or upregulate more SOD1. But because we're getting more SOD1 and it's not clearing the body of the free radicals, it is then creating more oxidative stress. Does that make So that's where that cycle comes from.
Yeah.
Oxidative stress, you can think of it. I have a slide that talks about it, but think of it like it's the aging process that accelerates aging. It's cellular death. It's associated with a host of diseases, those types of things. So we don't want a lot of oxidative stress. The problem with degenerative myelopathy is the gene mutation, because typically the body would just take care of it, right? But with our dogs with DM, where they have that gene mutation, it actually hinders the process and actually accelerates the disease.
So, Sarah, if we look from a rehab perspective, I mean, we would be primarily looking at treating this sort of externally, right? So looking at the proprioceptive deficits and looking at the muscle wastage and any compensatory changes. But there's a whole lot of internal things that are happening here. And it seems to me like we need to be treating both. So if we treat just the one, the external, and we just manage all those things that I mentioned now, all that damage is still going to carry on happening. So is there a way in which we can decrease that oxidative stress that's happening and potentially decrease the glutamate and that, decrease that SOD1 enzyme?
Yes, and I'm going to get you to take me back out of this for a moment, Meg, if that's okay. And I'll probably jump back in again in a moment, but thank you. So I like to be able to talk to your face where I'm talking to a screen. I have spent a lot of time looking at this and, what works and what doesn't. And there's a number of different things that we can do and we can encourage our clients to do. And something that I know is for lack of a better word, it's an inflammatory topic, but I'm going to say it anyway because I really think it does make a difference. Is from the internal perspective, we want to promote as much health and balance within the body as we can. So on the food side, I do really believe that these dogs should be eating real food. It doesn't mean they have to eat raw. In fact, I think that a lot of them don't do well on raw food because they don't have the enzymes. It's just such an all different diet, and it's not necessarily, we want to make sure it's as balanced as we can, but to feed on processed food, because there's so much that goes into processed food in terms of it creates more inflammation in the body because it is digested faster. It contains a lot of byproducts. There's, I know there's been discussions around things like AGEs, and I'm not even going to get into that because it's not my field. But at the end of the day, I use this as an example. For me, if I was to go to the grocery store and go into the organic section and buy a microwavable dinner in the organic section, or that's going to be better than me just buying my regular, I don't know, do you guys have lean cuisine there? But just buying a regular microwave dinner from the other section because the ingredients are better, right? And there's less ingredients in there. But if I make my food instead of buying the microwave dinner, which one is going to be healthier? Which one's going to cause less stress in my body? Which one is going to be more easier for me to digest? So feeding that real food, I think, is really important because we want to turn off that inflammation process as much as we can. We want to improve the bioavailability of what they have. We want to know what we're feeding our dogs. I see a lot of people jump to supplements when their dogs have DM. And if you're on a kibble-based diet and you're jumping into supplements, I think about how much money are people spending on supplementing when it's kind of like trying to put out a house fire with a garden hose. So the diet side of it is one that I do really advocate for, as well as the environment dogs are in. Think of like children, they're all lower to the floor, right? They're, everything that's in the air, everything that's in our environment, they're more susceptible to. So if people have like those plug-in air fresheners, they're putting chemicals on their yard, those types of things, those are all going to stress the body more, the environmental stressors, which can also contribute to disease, acceleration that way, because all of this is inducing more oxidative stress in the body. There's more free radicals, the body's got to do something about it, and then we get more SOD1. The other piece of it is on the exercise side of it. And this is where I found this really interesting, is we talk with DM about moderating exercise, but never really talk a lot about the why behind it. And the why is, again, because of that high level of, those really intense exercises are creating more oxidative stress in the body. And with DM, because of the changes that are going on in the nervous system, they're also changing. Now they're realizing that the skeletal muscle is changing as well. If you look at the aging process, there's many parallels between the aging process and what's happening within degenerative myelopathy, where those skeletal muscles are changing. There's less of the those type 2 muscle fibers and things like that. So when our dogs with DM do a lot of exercise that's really intense, they can't necessarily, their risk of injury is higher. Their ability to repair those muscle fibers is impaired, and it's more and more impaired as the disease progresses. That is also contributing to disease progression. And those are all, even though, I'm not sure if you look at the exercises internal, external, but I think that there's a whole host of things that are going on there that can be addressed, that are potentially, even if you're not thinking about slowing disease progression, you're still thinking about keeping the dog as comfortable and as mobile as possible for as long as possible. So yeah, there's definitely a lot you can do that way. I do think I have some slides on that too, but I do have the one. This was something on the exercise side of it, and probably we'll talk a little bit about it. But this was a really interesting study. There's a couple studies out there, and this one actually found that lower, and this is on the human side, but they were looking, I believe, at mice with the SOD1 gene mutation, and found that those low to moderate exercise activities actually were shown to delay disease progression, essentially. And there's other studies that I've found, in particular ones that talk about water therapy, where the earlier we can intervene and help, the earlier the better. And these lower intensity exercises and the water therapy exercises have actually been shown in some of these studies to prolong survival time. And not just survival time, but keeping an animal or a human functional, having a good quality of life, minimizing pain, other things like that. So I think that is really important to consider. And personally, it's something that I've struggled with in explaining to clients in the past as to why we want to do this. And the other piece of it, again, is their window for recovery from exercise is smaller than a dog that doesn't have DM. So they're at higher risk of damaging those muscles and not recovering from them.
Yeah, I must say, in the cases that I've treated, those ones that, you put into the underwater treadmill and the client comes sort of consistently in the beginning twice a week, and then eventually get them down to a once a week kind of maintenance. Mm-hmm. And, you'll go on maybe for 6 months doing that. And then they'll say, well, he's doing so much better, or he's maintaining. And then they'll say, I'm going to try and decrease it. And as soon as they decrease it, literally, you just see the deterioration happen. And then they're like, no, we're going back. We're going back to once a week, I've really, really seen that in those cases. That you just need to maintain them. You can't stop. As soon as you stop doing what you're doing, they start to deteriorate again.
That's absolutely true. And it's, it becomes a question, well, I don't know if what we're doing is really working, or is it really helping? I'm not really seeing a change. And it is really hard to get our heads around not seeing a change is a good thing, because we're so used to looking for those improvements and those benefits and those types of things. And then when we take our foot off the gas, then we start to get the decline in mobility and those little impacts. And I really do think, I personally don't have an underwater treadmill. I wish I did. But to get dogs, having had a dog with DM, and she did underwater treadmill, I took her to underwater treadmill for twice a week, once to twice a week for the latter part of her life for years. Years. And I know that's not accessible to everyone. I did have pet insurance for her, which made it better. But getting her upright, the benefits of getting a dog upright are, and these dogs are spend a lot of time down. I mean, we're talking about skin integrity, we're talking about circulation, just proper body positioning, body awareness, feeling like a dog. The mental side of it, I'm just going to click to that next slide for a second, but the mental health side of it is so critical as well. So we're looking at lymphatic drainage, we're looking at circulation, we're looking at neuro input, but also the enrichment side of it. I think we tend to forget about, getting dogs to do what is innate to them. So with Sam, she was a German Shepherd. She liked to use her nose. So I used to do a lot of brain games with her, enrichment. And then she's also getting some range of motion. She's getting weight shifting. I would try to do them outside, so she would be in more of a natural environment. Sometimes people think that because their dogs have DM, they can't do all these things. And it's not that they can't do them. We have a saying in my Facebook group, it's not over, it's just different. And that's really what's going on here. Is I think some of them actually decline faster because they are taken out of their social animals that are then isolated. They're taken out of their environment where they interact with the rest of the world. And then we also know that they get a lot of things from, the smelling, they're getting things that way and that enrichment. And then they're also getting, things that are good for their gut and their gut health, just, prebiotics from the dirt and those types of things. So fresh air, sunshine, it's important that we're not forgetting about that within the realm of the conversation about everything else, or because we've, pet parents have been given this dire diagnosis and they think they're at the end of the road and can't see past it, just doing it in a little bit different of a way. I've actually been questioned from time to time when Sam was alive and even now about wheelchairs and whether or not, some people say it's not natural. It's cruel to put them in wheelchairs. I literally chased her down the beach while she ran after her brother, my other dog, through the water while people laughed at us as I'm chasing this dog in a wheelchair down the beach. I can tell you right now, that was, it might not have been totally natural, but she was having a blast. It was, still a really good thing. So, thinking a little bit outside of the box that way, I think is really important, and giving them the opportunity. As people, if we have a decline in mobility, maybe we get a walker, maybe we get a cane, maybe we get a brace. There's options. So we need to always remember that there's options with these dogs. And just talking a little bit about the exercise side of it for a moment, again, wheelchairs, I think, need to be introduced earlier, because the dogs will also get deconditioned when they have neurologic conditions, not just DM, but other ones. They will lose a lot of their strength, which then puts a lot of stress on their front legs, on their forelimbs, and they have a decline in their overall exercise. And sometimes when wheelchairs are introduced really late, the dog doesn't want to move in it, but they've had months where their fitness level has declined and the front end has been overstressed. So I think by introducing them earlier than we might think we need them, we actually give the dog to be an opportunity to be upright, independent, exploring their environment more, getting that sensory input. But the other piece of this, and this ties back a little bit, Meg, to that ebb and flow. I think that one of the things, that contributes to the decline is if they're starting to show weakness in the pelvic limbs. Remember, it's that asymmetrical weakness. So they always seem to go down to one side first. That's been your experience too?
Yeah.
Yeah. So they get that rotation through the spine, and often it's right in that T13, L1 kind of region where suddenly they've got that big twisting action going on. Think about, if we're talking about oxidative stress in the body and comorbidities and not wanting to upregulate SOD1 because it's going to continue with progressing the disease, then we're getting that rotation constant and then we're inducing more inflammation because we're getting more injury in that area in the back. So, things like working on core control very, very early. And also as they begin to show that decline in mobility, using harnesses, using wheelchairs to promote good spinal alignment. And, it's hard because I've been there, but I really discourage crawling. I'm not an advocate of the dogs when they're pulling themselves, when they start to lose that mobility. The stress on the front end, plus the torque that they're putting through the spine constantly, I think is also lending itself to disease progression as well. So that's something that I've thought about quite a bit related to that as well.
Sarah, obviously you've learned a lot since Sammy passed. If you had to right now be back in that same situation where you have another dog now that is diagnosed with DM, can you, in summary, just go through how you would manage and treat that dog? So, because what I'm hearing is, and I think back to when I was treating patients. I'm obviously not in practice now anymore, but I remember I had this piece of paper, and it was from a vet, and I can't remember the vet's name, but I found it on the internet, and it was like a piece of paper of all these different supplements that you could give.
Right.
And I mean, as far as the recommendation that I would go from sort of treating it internally, it would really just be like trying to get them onto a more natural based food, so less processed food, give them the list of supplements, like ideally you should be giving all of these. And then I would just be treating sort of the from the exercise components and managing any secondary pain, because like you said, although there isn't generally, the disease itself doesn't cause pain. There's a lot of compensatory pain and muscle tension and fascia and all those kind of things. So I think it would be nice just to get an idea now of like your way of treating, just as a summary for us vet rehabbers out there, to make sure that we are approaching every single prong, because this to me seems a whole lot more multi-pronged than I ever realized, So, I mean, as you just mentioned, even the enrichment side of things, obviously we touch on that, but there's maybe more to that.
There is. And I'm looking to my side because I have a little model that I actually created. I can't show it to you because it's a little bit far away, but I'm just writing it down related to how I would treat and sort of what owners can do on their own, and then how we complement it. And as I get into that, I do want to add just something to reiterate of treating the whole dog and not just the disease. I met a woman online a year or two ago that had a corgi, and the corgi had degenerative myelopathy. And when he passed, she did an autopsy, and there was evidence of degenerative myelopathy. Absolutely. It was confirmed post-mortem that this dog did have DM. The dog also had 8 disc herniations. So I think that I just want to again reiterate, I feel like pain is missed a lot in dogs with DM. And if we're talking about slowing disease progression, improving quality of life, we need to be aware of that. And I'm not saying that we are necessarily needing to put the dogs on all kinds of medications, because some of those actually will accelerate the disease. But that's where, again, we're looking at treating the whole dog and the preventative side that we can also be doing, and to recognize that some of the symptoms that we might be seeing are not degenerative myelopathy. For example, because this was the one other point that I wanted to bring up, I'm going to say something lofty, but I can almost diagnose a urinary tract infection in a dog with DM before the owner or the vet. because of the subtle changes in mobility and personality. We know on the human side, if you are in the hospital and you have a sudden change in personality, they are testing you for a UTI ASAP. And it's the same thing with these dogs. What often will take down dogs with DM is not DM. It's these secondary conditions. They're more susceptible to injuries that are missed, skin integrity, and urinary tract infections. So hygiene, bladder expression, diet, and we're going to talk a little bit more about supplementation and what I would do. Learning how to do those things early, and even things like if you have a dog with paralysis and they seem to be kicking their legs a little bit more, they're a little bit unsettled, or they have significant weakness in the hind end, that actually, yeah, it could be a sign that they need to have a bowel movement, but it could also be a sign that they have a urinary tract infection brewing. And you want to address those things early, because I found with UTIs, they take down dogs with DM a lot. They have a sudden decline in mobility, change in personality, they're lethargic, depressed, kicking their legs, all of those things. So it's important that we recognize that not everything we're seeing is degenerative myelopathy. You need to recognize that there could be other things going on. So I'm trying to remember exactly how you asked the question and what I would do.
Yeah,
and
so
nobody's asked me that question yet. I'm surprised, actually. That's a great question.
yeah, so if you could just, in summary,
Yeah.
like if you had to get another dog now, right, that was diagnosed with DM, how would you treat it? As an owner, what would you do? So like what food you would feed it, what supplements you would give it, what exercise you would give it, and what other enrichment or whatever.
Okay. So if I'm going to go back to the Sam scenario, because there are things that I would have done the same and there's things that I would have done different had I known than what I know now. One is, so absolutely let's talk about the diet side of things first. She was on a lot of the same things that I would recommend now. And I actually did have a little bit of crossing paths with Dr. Marsden way back then. But as you know, I've worked with him and I've learning Chinese medicine has literally been like learning a different language. And I am not fluent in that language, but I've gone from being a little bit of a skeptic, even though I'm a yogi at heart, to understanding that there really is a place for it and it really does make a difference. And, his formulas with the DM formula with the gold standard herbs, I really do think like that's where when we're talking about treating this acute versus chronic, like I have a slide in there, we didn't get to it, but I said, treat it like it's hot. I think that really is important, because I've also noticed, and I'm going to jump around a little bit, but treat it like it's hot. So if we are following the laser protocol, for example, that Debbie Chiraka has, I find that works too. But if you taper it down because of time or whatnot, or you kind of do your own twist on it, I really do think that it actually could be hindering or possibly, hindering the treatment, but possibly progressing the disease. Like I think that higher intensity, that notion of treating it like it's an acute inflammatory state versus something that's more chronic, is really necessary to treating dogs with degenerative myelopathy, and doing that really early, because everything has to happen early. I think that was one part, would be the diet, but also doing things early instead of waiting for the progression, because we want to keep them upright longer. And if they're already upright, it's so much easier to do. And there's so much more opportunity to do things in that stage. Talking again about the spinal health. So, the acupuncture, the little bit of gentle chiromobilizations, the activity modification. She was already on fresh food, which I think made a really big difference for her. And, getting her outside made a massive difference. Sam's routine changed, but in some ways didn't change. So we did maybe a little bit less, but she still went to the park every day. She went to the beach. She just went in her wheelchair. She went with the harness, those types of things, the hygiene side of it. other supplements that are a little bit newer. So definitely the DM formula with gold standard herbs. Also, lion's mane is another one that I advocate for a lot with dogs with DM. And, I've done some work with Dr. Becker. And I remember at one point she was like, I would give it to her intravenously now if I could. As far as lion's mane goes, there's a lot of research out on lion's mane and neurologic health, whether it's brain health, spinal cord health. So I really do think that even though we don't understand it a lot, it has its place. And we mentioned the fresh food, and omega-3 would be another one that I would definitely, and krill oil or herring, because it crosses the blood-brain barrier faster, those types of things. But just feeding as much unprocessed fresh as possible, absolutely. Activity modification and really focusing earlier. One of the reasons I think Sammy actually lived as long as she did is she had those cruciate tears? I did so much rehab for her through that process that I think that actually served us when she developed degenerative myelopathy, because she was really strong. And I think that made a really big difference. So that ideal body weight, those types of things. I probably would put more emphasis on a little bit of a exercise routine that really helps, especially with the central stability. And something that I've been beginning to work with dogs now that I would do is also beginning to treat a little bit like that neurodevelopmental sequencing, like that we do with our IVD dogs when they recover, is to try and maintain those proper movement patterns. Like if a dog is laying down and they have the mobility to get them to sit and get them to stand and use their back legs. So trying to maintain some of those neuro links and doing a little bit more neurofacilitation early on with that whole use it or lose it gamut. And the one thing I didn't have then would have been that new laser protocol. So again, treat it like it's hot, head to tail, almost basically your T3 down to L7 and those higher parameters. And that was something that I learned through both Debbie and through Dr. Marsden, is the importance of the joules and just those higher settings. He originally was saying like at least 30 joules per point. And I've seen some of Debbie's new stuff that's come out and again, it's just a lot more energy that you're putting in there, because you want to actually, you don't want to treat it like it's chronic. You don't want to actually induce more nitric oxide. We want to take it past that. So that would be the other thing that I would do differently. I think those are, and maintaining, if it's still going to progress, to not give up, to maintain throughout the disease progression. Just because a dog goes down doesn't mean that we should stop things. Just because we did her exercises supported in the underwater treadmill. She used to swim in the underwater treadmill. I see lots of dogs get kicked out of underwater treadmill. There's no reason for that. Reassess, change the parameters, keep going as long as the dog wants to be in it. So yeah, I'm not sure if I did that in a nutshell or not, but that's what.
No, awesome. That was a great summary. We've got a few questions. So Laura asked, can you suggest reputable herbal companies to get the lion's mane? I have a spinal case. I may suggest they get some.
I tend to use, and I want to say Stanish, but he's the mushroom man. I think it's called Host Defense is the one that I often use. But basically, you're looking for something that just has the mushrooms in it when you're looking for it. And I can drop some more links in there, but sometimes there's a lot of additives or you don't know where they're sourced and those types of things. So you're just looking for that quality ingredients. There's a little bit more to it than that. Again, this is not totally my forte, but I like the Host Defense is the one that I often will use. But there are some canine companies that also have lion's mane available.
Awesome. So from the Veterinary Physiotherapy on the Isle of Mull in Scotland. Apologies, are you advocating to treat in early stages as chronic versus inflammatory disease, as I'm not to use warming electrotherapies?
Okay, I'm not sure I totally understand the question. I'm going to try to answer it. And this is, if a dog is presenting and does have the gene mutation and has some of the clinical signs of degenerative myelopathy, then I would, want to do everything I could to reduce oxidative stress within the body, because that's going to induce more of the mutated SOD1. So I would actually start using higher. And again, this is what I would do. There's a lot of, the research is leaning this way, but there's a lot of work that still needs to be done. But I would be, if I was doing laser therapy, I would be doing that higher settings. When I was treating that way, I would be doing some activity modifications, and I would be feeding that fresh food and supplementing that way. Versus, if I had a younger dog that maybe carried the genetic mutation that had no presentation, then I would be more likely on the chronic side. Did that answer the question?
Yeah, I think so. There's another question.
We want to reduce inflammation. That's where the treat it like it's hot comes from. Yeah, and we can drop those articles in there. Sorry, Meg.
Yeah, no, I think he's also asked, or she said, treat like it's hot. Is that to add heat?
Oh, sorry. So what I mean by that is basically to treat it as if you were treating an acute inflammatory condition versus a chronic degenerative condition. So that's what I mean when I say treat it like it's hot, is you would use those higher settings on your modalities that are going to reduce inflammation versus ones that were those lower subacute chronic settings. We don't want to use those.
Awesome. Thank you. Another one, Avani says, how does laser help with DM? Is there any specific
do I ever want to redirect that question? But laser, basically, I mean, it's bringing more energy into that area. So you're going through it again. This is not, I'm not an expert in this, but you're going through the tissues, trying to basically induce more healthy cell growth, more energy within the cells. If you think of like ATP, those types of things, as well as decreasing inflammation in there.
Awesome. So thanks so much for that. Sarah, if people want to follow you and find out more about DM, because you have some great resources, you've obviously got your groups, can you tell us where they can find you?
Absolutely. So my business is called Upward Dog Rehab and Wellness. So I do have a link for that. And I do help people both and their dogs locally and in person. I also do one-to-one mobility coaching online and do a lot of support for other professionals. So that's upwarddogrehab.com. And then I also have our Facebook community, which is called Living with Dogs with Disabilities, which is a little bit broader than DM, but again, there's lots of professionals in there as well as pet parents, and where they can learn from each other, as well as all of these interviews that I also host are saved within that Facebook group. So that is available, and it's a really supportive and amazing community that has grown. In addition, I do have courses that I offer online, and I'm currently changing up a few. And the website is livingwithdogswithdisabilities.thinkific.com. And I'm turning a lot of my courses into small workshops to help pet parents as well. Right now, there is something on there called, it's the replays from the Navigating DM and Canine Disc Disease that I did back in January. That if you want to get more in depth with what we talked about today, that would be definitely something I would encourage people to take a look at. Handle on Instagram and Facebook is at Upward Dog Rehab. And coming soon, I don't have the name, but it'll be on my website. I am taking a lot of this content and turning it into a podcast, because I just want it to be able to reach more people and more professionals, more pet parents, with what you can do to support these dogs. So that will be announced online. So keep your eye out for that, because it's coming the end of this month, the beginning of next month. But Upward Dog Rehab and Living with Dogs with Disabilities are the places to find me and where I can help out.
Sarah, thank you so much for your time. It's been absolutely amazing chatting to you. Thanks, everyone. Thanks so much for joining. Take care. Bye-bye.
Thank you.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Curacor. Their sponsorship allows us to be able to give this podcast to you for free. So please go and check them out at curacor.org. Don't forget to bookmark the next Vet Rehab Summit. It's on Saturday, the 31st of August, 2024. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Online Pet Health members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.